maybe you can go a little bit, roll it for the dog.
About dementia. I will begin by saying, for those of you who don't know me, I am a physician, a doctor. I'm a geriatrician, which means treating older people. So maybe we will start by saying what is dementia. Dementia is a very difficult to explain disease or difficult to explain situation, because we cannot see it. If we look at a person, if a person has a problem with his leg, we'll see that he can't walk right. Or if a person has a problem with his lung, we will see that he can't breathe easily. But if a person has dementia, when we look at him, we don't see anything. And in the beginning, even when we talk to him, sometimes we will not really understand what's the problem, what is wrong. So it's a disability, but it is very hard to diagnose it and to see it when we first meet the person. The person looks the same, but something in the behavior is changing gradually. Dementia is a disease of the brain. It makes the people...
Is it reversible or not?
Dementia is not reversible, but it is a very important question, because some situations that we think that they are dementia are reversible because they are not dementia.
Dementia and Alzheimer's is the same or no?
Okay, I will answer it in 1 second. I want to answer a little bit more about your first question, and then I will ask the second question. Then I will answer the second question. Hi, Nishma. So, about your first question, I was going to talk about it a little bit later on, but I will talk about it now because it's one of the most important things with dementia. If a person is starting to be confused very suddenly, like he was okay until a week ago or until a month ago, and now suddenly he doesn't remember stuff, and he doesn't know who I am, or he doesn't recognize his children, or he doesn't know how to put his clothes. But it was okay until a day ago, a week ago. It is not dementia, and we need to find out what it is. I will tell תקווה שעוד לא בקושי התחלתי לדבר, I just began to talk, and בוקר אור, and he asked if what is your name? Kiko. So Kiko asked me if dementia is reversible. So I'm talking a little bit about that before we'll talk about other stuff. So there is a situation that is called delirium. In delirium, the person is confused and forgetful and doesn't understand the situation, and sometimes you can see things that are not there, or talk stupid things, like talk about that people is saying stuff that you can't see, but he see it. But it happened in a minute or in a day or in a week, not gradually. And for delirium, which is a confusion that is reversible, not like dementia, there is a reason. Sometimes it's difficult for us to find the reason, but there is a reason. It can be because of a fever, like the person has pneumonia or urinary tract infection, or a wound, exactly, or a wound that make an infection, and the infection go to the blood, and it affects everything, including the brain. But if we will treat the reason for the delirium, the person will come back to the way he was before. So this is not dementia. And if we will not see it, and we will not diagnose it, sorry about my English and breaking this. So if we will not see it and we will not diagnose it, that with time, it will stay. So we need to diagnose it, and this is one of the most important things for all of us who treat older people. Because you will be the first one to notice. You're there, you are living with them. The children not living in the same house. So the children, they say, okay, so he's confused, and now he's confused a little bit more. But no, you know it's not the same. So if you see something like that, you need to tell to the child or to the person in charge in the kibbutz or in the family or whoever you are usually speaking with, and to tell them something is wrong, and they should bring them to the clinic to see what is wrong. As I told you, sometimes it has a medical reason, like fever or anemia or other medical reasons, like infections or many. But sometimes it's not because of a disease. Sometimes it's because something is changed. Like sometimes it's because of painful, like they have pain in their knee, but will make them confused. It happens to older people. It usually doesn't happen to younger people, like all of you, but it happens to older people that if there's something is changed, the brain cannot.
Come on.
Yes, but it cannot understand this change, and it reacts in a strange way. So if there is an acute change, we need to look for a reason, and your job is to tell it to the person who is in charge or is also taking care of this old person that you are taking care of. Okay, and this is called delirium, and it is not dementia, and this is the answer for your first question.
Reversible.
The answer for your second question that you had, Kiko, is the second question was, is Alzheimer and dementia are the same?
Yes.
So Alzheimer is one kind of dementia. There are many kinds of dementia. There is Alzheimer's disease, and there is vascular dementia, and there is Lewy body dementia, and there is frontotemporal dementia. So there are many kinds of dementia, and Alzheimer is the most common one. So most people know Alzheimer and think it's the same as dementia, but sometimes people have dementia not because of Alzheimer's disease, but because they have problem with the blood flow to their brain. Like they had mini strokes, mini CVAs, and it damaged different parts of the brain, and then they have problem with memory, with concentration, with vision, with many stuff that the brain is in charge of. And they will have vascular dementia, because the dementia is because of a vascular problem. And there are other kinds that maybe we will talk about later, but this is the answer to your question. So as I started saying, dementia is a disease of the brain. It happens in the brain. And it's a process. It doesn't happen at once. And the dementia is because it's a disease of the brain, the way that it looks depends on which part of the brain is damaged. The most common situation that happens in Alzheimer's disease, which is the most common dementia, as we said, is that the first thing that we have problem with is our memory. So the person will forget where he put stuff, or he will forget names, like, no, what's her name? The person that we met yesterday and can't say the name. But this happened to all of us also. We also, I mean, I just told you my name is HADASH. Some of you remember, but some of you think, okay, what was the name? It was one of those weird Israeli names. And you don't know, and you don't remember it in the minute you want. So this is, when you have it, it doesn't mean you have dementia. But if it adds up to many things, then we are starting to suspect. So sometimes the problem is with the memory, remembering where I put stuff, remembering names, remembering what people told me yesterday, remembering that I have an appointment. Like I told you 5 minutes ago, we are going to the clinic, and why are you asking again where are we going? But this is the dementia. The brain cannot keep the things that we just told the person. So it fades away, and the person does not remember what we just told him. Sometimes the memory is okay, but there is a problem in understanding language. Like the person you're telling them something, and they don't really understand what you mean. Because the language, the place in the brain that is in charge of the language is the one that's damaged. So you're saying it very clearly, no difficult word in the language that they do understand, which is a big problem in your communication with the people you treat, because your native language are not the same, so it makes problem. It's difficult sometimes to understand because of an accent. Like I assume that some of you have problem understanding me because of my Hebrew accent, and when I speak with you, I sometimes have problem understanding you because of your native accent, which is from India or from the Philippines or from wherever, all the places that people are coming here to work. But I'm not talking about that. I'm talking, even if they are talking with their child who has the same language, they can't really understand what he means, because the place in the brain that is damaged is the place that understands language. And sometimes, because of that damage, they will have a problem talking, like they will want to say, hello, my name is Hadassah, I'm a geriatrician, but what will come out is, I'm a Hadassah, hello. Like it's begin to look like a salad. They don't say exactly the phrase that they want. They don't phrase sentences as they wanted to phrase it. And sometimes it will even be gibberish. Like I want to say hello, my name is Hadassah, and I will say Gabas. Because something between the brain to the mouth doesn't connect well. And what we need to understand is that they don't do it because they want. They are not laughing at us. They are not trying to annoy us. They are not. It's not that if they will try harder, they will do it okay. It's a disease of the brain, and they cannot control it. Even if sometimes it's really okay, and then on the other time it's really not okay, they cannot control it. They cannot make the okay time go for the not okay time. The brain is playing with them also, not only with us. So it's not in purpose. If they are, usually he can do stuff. Usually he can get up and put his pants. And now he doesn't remember what to do, and he's holding his pants and he's looking and he doesn't know what to do. It's not because he wants us to do it for him. It's because in that moment the brain do not connect the dots of the action that he wants to do correctly. And it's very hard for a person to understand it. How come yesterday he did it okay? So what happened this morning? Why this morning is so upside down? But this is the way dementia is. It's not something that people do. And as the time go by, things get worse, because as we said, it is not something that goes like, it's not delirium, that it was bad and now it will be okay. With the time, the process is that the brain loses more and more functions, and the person can do less and less things and need less and less things and need help of another person, of the people around him, to do even everyday stuff. Like at the beginning he just forgot names or forgot where he put his wallet or where he put his keys. But now he doesn't remember what are the order of the things that a person needs to do to put a shirt. Like he look at the shirt and he doesn't sure if he should put it where the hands go, where the head go, where everything is mixing up in the brain. And one of the special things about dementia is, although we lose a lot of our ability to function and to remember and to concentrate and to speak and to do stuff, one of the things that people don't lose, that remains, is the feeling. And if we are happy, they feel happy, and they feel sad, and they feel angry, and they feel frustrated. The feelings stays. So probably sometimes we cannot even communicate. I cannot say, but if the person sees me, and I am smiling, and I am nice, and I'm going to touch you, okay? So I'm doing like this. He feels the feeling that I'm transmitting to him. Much better if I will say good morning, or if I will say good morning. He will not. The words are the same, but this is what they cannot understand. And if I had a bad night, okay, I just heard from my home that my child is sick back in the Philippines, or I just heard that something happened and I have bad mood. I'm a person. I'm entitled. I just came from my house. My daughter woke up today and she told me I'm not going to school. I'm not going to school. I'm feeling bad. So I cannot come to the work and be as nice as I usually, because in my head I all the time worried. What about my daughter? She's at home. But if the person has dementia, he cannot understand the words. He can understand what I transmit. So if I will be in that day in my clinic, like in a physician, and I will be like that, okay, so why did you come? How can I help you? The person with dementia will feel that he came to a bad place. There's an awful person that is talking like this. This is what he gets. But if I can control myself, and although I have a bad day, I just had a fight with my husband, okay? I have a bad day today. But when I come to the clinic and I see the person with dementia, I'm saying, good morning, how are you? How can I help you today? then you will get a totally different feeling than if I'm saying, okay, how can I help you? Why did you come to the clinic? Totally different. Although I'm saying the same thing, I'm saying I want to help you. But what I'm transmitting is, go away, I don't have any time for you. My head is with my daughter or with my husband or with someone else. And for you, who are living with the person in the same house, it's much more difficult because at work I can act. I can come and do as if everything okay, although my head is somewhere else, in the war or with my family or about anything else. But if you have a bad morning and you come to the patient and say, and bark at him, like this, yes, then you will have awful day because he will get nervous. And then when you tell him, okay, we need to go to eat, you will not want to go because you are not a good person. You are the person who is on him. But if you are coming and although you are feeling bad, you are saying, good morning, let's eat, we need to eat, you have much better chance of the person to go along with you. Now, even if you are in your best behavior and you are doing the act, and although you are worried about something else, you are smiling and you are calm, sometimes they will be aggressive anyway. It's not only depend of you, on you. But your part is very big. And also, you should understand, because the feelings are there, then they see if you are happy, if you are sad, if you are angry, much more than what you say. So for you, it is a tool in your hand. You can affect the day you will have, the day that you have with your the person you are treating, with your patient. I'm saying patient because I'm a doctor. I'm not sure how to say it. The person that you are treating.
Most of the time we call it Abba Ima something.
Yes, and I will say something about that also. Not for all the people, it is a good feeling. I mean, when you are saying Abba, yes, when you are saying Abba, your purpose is nice. You want to say, I respect you, like my father. I love my father, so I'm calling you father because I. But sometimes for people, they say, okay, she's not my daughter. You're not my daughter. So we should always.
There's also a part of like that, patient that, don't call me Abba,
exactly.
don't call me Ima.
And we should respect it, exactly. If my name is HADASH, I want you, some people come to my clinic and say doctor all the time. They say, doctor, how are you, doctor? And I like people calling me my name. My name is HADASH. So I'm saying it. I'm saying, I'm fine, thank you. You can call me HADASH because this is my name. But another doctor can feel exactly the opposite. You're calling, hi HADASH, and you will say, sorry, I'm a doctor. Treat me like with the respect you need.
We do have like this kind of respect. If we come to the doctor, we are not calling you your name. We're calling doctor.
This is the way you should. But if after you called me doctor or ma'am, and I'm saying you can call me HADASH, then you will change it and call me HADASH. The same with the people you are treating. For some of them, it's very nice. You are calling them Ima or Abba, and they see the love in this expression. But for some of them, even their children don't call him Ima. In some kibbutzim, some children call their parents in their name, like Moshe. It depends on the family, on the culture, on many things. So the person can feel very awkward that you are calling them Ima. So they can tell you, no, call me HADASH, call me Moshe, call me whatever the name is. Okay. So the important things about what I just said is remember that even if they don't understand the word, they understand the feeling. I think if I need to make some highlight of this conversation, this is one of the highlights. Okay? This is the thing to remember and to go with. One more thing that I want, a thought that I have that I want to share with you. As we said, dementia is a disease of the brain.
Yes.
And this is a little bit philosophical, but what is the brain? The brain is the thing that make us ourselves. Like in our brain, there is our qualities. In our brain, there is our behavior. Like the way I behave is not the way that you behave, because we are different people. So this difference between you and me is in my brain. All the things that I know in my brain, all the people that I know, all the relationships that I have with my family, with my friends, with my co-worker, with the people I teach, everything I hold it in my brain. All my intellectual abilities, my emotional abilities, my disabilities. There are things that I cannot do. There are things that all of you cannot do. All of these things are in our brain. And because dementia is a disease of the brain, the people really lose themselves. They lose the essence of being the person that they are.
Used to be.
Exactly. But this is one of the things that make this disease so difficult and so horrible, because it's not that I lost my leg, which is a horrible thing. I'm not taking everything that you lose in your health is horrible. But it's not that I can't breathe. It's that I'm losing the person that I am, my memories, my abilities, my character. And it's difficult for the person because in the beginning of the disease, when the disease starts to happen, some of the people understand what's happening to them. They understand, maybe they had a parents with dementia, maybe they had a good friend with dementia, and they understand that this is what starts to happen. And it's an awful thing to know, that this is what, you know where it goes. You already saw this disease on other people from your kibbutz or from your family or from your friends, and those people might be depressed because they know, now I can't remember where I put my keys and who is this person who is in my house, but at the end I will not be able to clean myself and you're doing the important work that you are doing. You all the time take care of other people, but try to imagine another person come and clean your toothpick after doing kaki, okay? I can't imagine someone doing it for me, and I assume that most of you, when you imagine it, have a good day. When you imagine it, it's not a good feeling that someone needs to take your clothes off. I would never take my clothes off in front of all of you, right?
Yes.
And suddenly one of you come into my shower and you taking my clothes off.
Yes.
It's like really losing all my sense of respect of being a person. So some people with dementia who still understand it, it's a very, very difficult feeling. And we need to understand that when they are like saying, don't touch me, it's not because they are against us. It's because something feels wrong to them. How come this strange person who doesn't even speak the same language like me, like we cannot, and he comes and he touches me and in my most intimate parts, and he takes my clothes off and he thinks he can interfere in everything. And because I have dementia, I don't remember that he already did it yesterday and the day before. Each day is a new battle. Each day is a new fight. How come you're touching me? Who are you? What do you think to yourself? So when they are shoving us or shouting at us or say, don't touch me, what? It's not because we did something wrong, and it's not because they are bad people. It's because something doesn't feel right, something getting into my circle in the way that none of us would do to none of us. Like I would not do it to you. If you will come to me as a doctor and you will tell me, I have a problem breathing and I will want to listen to your lungs, I will not take your shirt off. I will ask you, can you please take your shirt off? I want to listen to your lung. The same with dementia people. Like when we are treating them, showering them, helping them clothes, we should not assume they understand that we are the caregiver, we are the metapelet, and it's of course we are taking their shirt off. Every time, each day, again and again, I will come to a person and I will touch you now, is it okay? And I will say, good morning. And even if she doesn't understand me because I'm speaking English with my accent and she is speaking Hebrew without knowing English, she will understand that I'm smiling and I'm touching him, and then I will say, I want to take your shirt off. I will show what I want to do. And when I do it, I will do it like this. I will not do it, so I will not come from here and touching you again, and do this. Because she doesn't understand. If someone came behind her and started to touch her, probably they want to attack her. If someone would come behind me and do to me this, the minute he's doing it, I will hit him. I mean, like, what does the thinker say? Why does a person take my shirt off? So always before doing something, I will be in front of the person and I will make eye contact. And even if he's very demanding, doesn't understand anything that I say. Okay, I'm saying that is nothing. He doesn't understand anything. He's an old person that cannot understand anything. He still has feeling.
Yes.
And if someone comes like this is an attack. And if someone comes like this, and saying hi, before I touch you, I'm saying hi, I'm HADASH, although she knows me, we met before, we did met before.
Yeah.
But she knows me and I know her and we met in the clinic, but I'm not assuming that she remembers where she met me, who I am. I'm saying, hi, I'm HADASH, I'm a physician, I want to examine you. Same thing with the people you treat.
How about
I'm saying, hi, I'm Lisa, and now we will take the clothes off, okay? I want to help you. I will take the clothes off, and then easily, and if she's not letting me, I will wait a minute. Because any other things that I do is attacking. You are attacking the person in their brain. Of course, none of you attack the person. I'm not saying that you are really attacking. I'm talking about the experience in the head of the person, okay? And the experience is a strange woman, a strange man came to me, touched me, want to take my clothes off. If I would be able to run, I would run. But because I can't run, I will shove him, I will shout, I will ask for help, I will cry, or if I'm an introvert person, then I will not do anything, but I will be frozen. What happens to people when you are attacked, if you are a strong person and you can run or hit, you will hit or run. But if you are not a strong person, sometimes you will just freeze. And it's easier for us to treat a person that is not aggressive. But for him, it's an awful experience.
Yes.
They froze, they are not letting us treat them, they just can't do anything because they're so frightened. So our job as people who treat people, me as a physician, you are as a caregiver, as a metapel or metapelet, our job is to be aware of it. And every day, every time in the day, to come to the person as if it is also the first time. It's like the 120 times that we are doing it, but it also might be a little bit the first time.
the first time for them?
Seeing that they can see us, talking in a calm way, asking before touching, okay? As I would ask you before touching you, even you're treating him always and you're wiping his toothpick, so you can say, of course, he's used to me touching him, I touching him every day. And no, say, I'm going to clean you now. And even if you think they don't understand you, they understand the music of the language. That I'm going to clean you, or go to the shower. It's another, I'm not good at, but you understand what I mean. I'm not doing a good example, but you understand what I mean.
We do.
What, you wanted to say something?
It's okay. We do. That's it's most of us dealing with this kind of situation. Taking a bath. Let them to get up from the bed. It's really, it's really hard time for them. It's really, we do it every day.
But it's also very hard for you. It's not easy thing
It's not so easy.
to do it all day, every day, again and again, and to be shouted at, and to be shoved, and to be. When I'm saying it, I'm not saying that you are to blame for their aggression, but I'm saying that you maybe have a way to make it less.
Yeah.
And it will be much better for them, but it will also be much better for you. Like getting shoved getting shoved or getting shouted at, or it's a bad experience for you too. It's not an easy experience, so it's a way to make your life better, not only their life better. The most important thing is to make their life better, because they are the old person and they are the sick person and you are treating them, so they are the focus. But it also makes your life very not easy.
There is a communication connection between.
Yes, exactly. As I said earlier, some of the people will understand what happened, and then they might be depressed or sad or angry, or other people, the dementia damaged their ability of the brain to understand the situation.
Yes.
So we all know they are demented, but they think they are totally okay. Okay, they have no problem, so why are you there? Why are you... Thank you. לא, לא, זה מעולה, זה מה שרציתי. הכל בסדר, רק רציתי משהו שאני אוכל לא לתפקד פה באופן מביך. So, sometimes they think everything is okay. They don't remember the name of their daughter, and they don't remember the name of the son, and they don't remember they know you, or they don't remember, they think they are 20 and they need to go to work this morning.
Yes, yeah.
Good morning, I'm going to the cars that I work, or I'm going to the field, I'm going to the Kutna, I'm going to the Pardes, I'm going
This
to
is
the
the
places.
hardest part.
The hardest part is the one that you need to deal with. It's the hardest if you're
It's the
dealing with it,
hardest
and it's
part.
not the hardest if it's another person's problem. Everything is very hard with dementia, nothing is easy. So, but it is very hard.
Again, this part, you know, that they are dealing to wake up in the morning, go to the work,
Yes,
and
I
then
want-
they are not working anymore, and try to explain to them we are not working anymore. This is the hardest part. You know.
So, one of
they
the
go out
mistakes
from
we do,
house,
one of the mistakes we all do
can,
is exactly what you said now.
Can.
It's trying to explain to them. There is no point
they
In
do
trying-
accept you, yes.
to explain, because if in my brain, I am now 30 years old. I just finished university. And I need to go to my clinic that was when I was 30, not now when I'm 55. But that, and so I'm saying, okay, so I'm driving to the hospital now.
Yes.
And you will tell me, but you are not working in the hospital. Then in my brain I am. So if you are saying that I'm not, you probably want to deceive me. You have a secret agenda. What do you want to do? So there is no point in trying to say you are wrong. You don't work, because if you do that, you really make the person feel that you are against them, because they know they work. I don't understand why. I'm a teacher. I'm going every day to the school, and I will go today to the school, and you will not tell me what to do, because I am a teacher. This is what I feel. The fact that I'm not working for 25 years now, and I stopped being a teacher 25 years ago, is not in my brain. And you're saying it will not prosper. It's like that I will tell you, how nice is that we are now on the beach, right? What lovely, look outside at the sea. If I would say it now, all of you will think this is a crazy doctor. What sea? There is no sea outside this window. But and I will say, no, look outside, look at the fish, they are swimming there, so you will be sure that I'm totally crazy. So when you're telling the person that you are working with, you not work for 20 years. No, I'm sure you're not doing it like that. I'm explaining it to understand, not because I think you're doing it like that, of course not.
No, we're doing just take it out, you know, take a canoe, go around. Then he said, I'm going to work. Go around a little bit.
Let's go to work. Exactly.
Go to work, exactly, and then coming back home.
And if you will all the time say stuff that we are going to work, then you will remember. But if you're saying, I want to go to work, and we say, okay, so let's eat breakfast and then we'll go.
Yes. Exactly.
First of all, after that breakfast, he might forget.
Yes.
So we will not continue saying, so let's go to work now. He forgot it, so we are no, we will not say it again.
Yes.
But if he remembers, which might be because in his brain he's 40 and he's going to work, then we say, okay, so let's go and let him lead. Maybe he will take you to the place he worked in the kibbutz, and you will see it, and people in the kibbutz know him. They know the situation. You will say hello, and then you will go to Cheder Ochel, or then you will get back to the house. But do not fight the things that they think is the reality, because in their mind it is the reality.
Yes.
And by fighting it, we are putting a mirror that something is really wrong. And it's very frightening for a person who feels that everything is okay, I'm okay, and I need to go to my class to teach. And you are putting a mirror and saying, no, you are not a 40-year-old teacher. You are a 90-year-old demented person, and you are putting this mirror in front of him when in his brain it's not a situation. It's very frightening situation. So usually we just need to go with the flow and try to change. And if we fight it, we make it worse, because the person needs to defend what he says. I am working, and it makes him remember even more that he's working, because he needs to defend it. And if you're saying just okay, then many times it will fade away. When you do other stuff, you will continue with the other stuff you are doing. So, and also it's not only against you, sometimes they will not understand why the children are doing things above their head. Like, usually they used to be the parents, the one that, and now the child is coming and taking their stuff and paying the bills, and why does he mess with my money? Why does he mess with my kitchen?
Okay.
Why does he mess with my clothes?
Mhm.
And so, and I'm telling the same thing to their children when I meet them. I'm saying, don't fight it, go along, tell them, respect the way that the person sees the thing, because a person with dementia cannot adjust, cannot change himself. So we are the ones that need to adjust and to change ourselves according to the way
Yes.
that he or she are. And when they are frustrated because they don't understand why you want them to go into the shower, they just showered. It happened a week ago. They didn't shower for a whole week now, but in their mind they just showered. So why are you want them to go? I just came out. You can see I'm clean. My clothes are clean. If we fight it, they will get more frustrated, and then sometimes the aggression will come out. And who will suffer from the aggression, from the shouting, from the shoving, from you? You're the one that gets it. You're the one that they can shove or shout or be angry on.
Empowered, you know.
Exactly. So it's really in our best interest to manage the situation and not making it worse.
Yes.
Like we are doing it for them, but we are also doing it for us. Because the one that suffers from these clashes are you. You're suffering from the clashes with the patient, and then with the family that thinks that you're doing something wrong, and that's the reason he's so nervous. So you have a lot of frontiers that you need to manage.
To deal with.
Exactly. So by trying to find a way above it, under it, across it, a way to not get into these clashes, you are also better in your own life, not only their life and the family life. Because the anger goes towards the person who is there, and the person that is there most of the day is you, right? If the child is there, it will go to them too. They will also be angry about on their children, but you are there for the longest time with the patient, so most of it will come out on you. I will give one more example. Let's say I cannot find my keys, okay? So I know where I put them. I always remember. I know I put them on the table. They are not on the table. So the logical thing that I think, someone took them. I put it on the table. They are not on the table. Someone took them. Who took my keys? Okay, there is this strange person here who I don't really know. She doesn't look from the kibbutz, right? She's not like all the people that I usually know. Something is different, her color is different, her face is different. Probably she's a thief. Probably she took it.
It's happened.
Why did you steal my wallet? Why did you steal my keys?
jewelry?
Okay, my jewelry, of course. I can. Why can't I find it? First of all, because I have problem of my keys are in my pocket. But I remember I put them on the table. So if they are not on the table, probably you took it. But another thing is, I know that people are stealing stuff. Okay, I know there are a lot of strange people here in the kibbutz. People who came from the north because of the war. People who came from the Philippines to treat people in the kibbutz. They are all very suspicious people. So I will hide my keys, that they will not be able to find them. So I'm putting it under the pillow that is on the chair in the room that we are not using. So this Filipinian person or Indian person or person from the north that came here because of the war, of the people who are working in the kibbutz because they are renovating the house. No, it doesn't matter, but this person, or my daughter, who is really against me and trying to steal stuff from me, it doesn't matter. It can be anyone. It can be the doctor who has a secret agenda and she wants to steal my money now. It can be any of us. It can be you, it can be me, it can be the people who work in this place, it can be anyone. So I will hide it. I will put it under the pillow in the room that nobody gets in, where nobody watches me. And then 5 minutes go by and I want my keys and it's not on the table where I put it. Now we cannot find it anywhere because no one go to that room where I put it under the pillow, under. No one will find it ever. After the person will die in 5 years, then they will find it under the pillow and in the room that nobody gets into. So for sure, you stole it. Because, and then they will accuse us. Why did you took my money? Why did you took my necklace?
Yes.
Why did you took my keys? Why did you took my soap? Why did you took my plastic bottle? Something that no one will steal ever. Sometimes they will say that we stole something that we would not even keep, that we would throw away, but they are keeping. It doesn't need to be a valuable thing. But they don't find it. It's valuable to them. This plastic bottle that you would throw away, they knew it was here and now it's not here. Probably you took it. Now if we will fight them, and we will say, I didn't took it, I never take stuff, I just, probably you put it somewhere, that not only you are a thief that took their bottle or their wallet or their key, you are also a liar and trying to manipulate them, okay? So if we are arguing, we are just making the situation worse. What we can do in this situation, of course we didn't steal it, so we will not say I took it, because I didn't took it. I'm not a thief and I'm not taking your stuff, of course. But I will not say that. What I will say, there are a lot of things that I can say, but I will give you one example, and you will use your imagination when in each case. But I can say, whoa, it's really annoying when I can't find my keys also. I will help you look for it. I'm not saying I didn't do it. I'm not arguing with the situation. I'm trying to help and look for stuff. People with dementia many times will hide stuff at the same place. They don't. It usually will be under the pillow in the room that nobody. When we find their stash, it's a good thing to remember. It can be in the refrigerator. It can be in a place that has no logic where the keys are. Under the pillow, in the refrigerator, in the oven, in my room. They can put it in your room. Hide it in your room, which makes you even more guilty. Why do you have my keys in your room? But when we find it, we will remember this is one of the stashes. This is one of the places that they put stuff. And we will not accuse them. We will not say, you see that this is here? You always put it here. We will not say that. We will say, oh, how lucky we are that we find it. Yes, no accusing. Not saying, you see that I didn't take it? Don't say it. Because then you are putting in their mind the phrase that you might took it. They don't remember that they said it before. But the way that you are saying it now, you're probably thinking about taking it. Okay? Now that you find it, because you are saying, you see that I didn't take it, they understand that you are thinking and taking it. Very suspicious person you are. Okay? So don't do that. Just say, oh, how happy I am we found it. And it will happen again. It will not resolve the situation. But it will not get to a fight between you. You are not saying, I'm not a thief. And she's saying, yes, you are. You always take my stuff. Don't get into this corner. Don't be cornered into this corner, but be with them. Be with their feeling. If they are sad because they can't find their keys, this is the feeling. As we said, the feeling stays. So when they say, I can't find my keys, what they are really saying is, I'm frustrated, I am sad, I am worried. So get connected with the feeling and be in the feeling with them. Say, wow, I'm also feeling sad when I can't find my keys. Let me help you find them. Be with them in the feeling, and then they will not feel that you are against them. Okay? So this
How about, Doctora, if somebody looking for their wife and their wife is gone? How do you deal with that?
Okay, so first of all, why they are looking for their wife?
Yes.
It's a very common thing, and I will give some more examples because you know those examples, and I want to put them also in the discussion. So what if they are saying, I want my wife and she died a year ago or 20 years ago or a week ago? And what if they are saying, this is not my house, I want to go home? And what if they are saying, I need to take care of my child because they are thinking about their baby, and I need to take my child from the kindergarten, I can't forget them in all of these feelings are examples for situations in which the person in his head is in another time. Like I now think about my youngest daughter who is in school. She's 12th grader, she's 18, and she is in school now. And if in 30 years I will be demented, I can still worry that I need to be on time to take her from school, because otherwise she needs to hitchhike, and I don't want her to hitchhike. So I need to be there on time. So I can wake up in the morning and you are treating me, I'm the old person, and I'd be very worried because if I will not get in time to the school of my daughter,
Yes.
she will hitchhike. And I don't want her to hitchhike. There are terrorists and there is a war. It ended 30 years ago, but in my head it happens now. So I'm very nervous, and you need to deal with it. With
Yes,
looking
of
for
course.
the
It's
wife,
happened to
or
me before.
taking care of the young child, or this is not my house. So again, as in the example of the keys that I can find and I think you stole it, again, we will not fight the feeling. I will not say, she's dead for 20 years, why are you looking for her? She's already dead, she died a long time. We've been to the cemetery yesterday. Your daughter took you to the cemetery, she's dead. Because then, if you think it's 30, there are two options. One is that the person will remember that she died. And then he will be very sad because it's the first time he's hearing it in his head. Okay, so he will be again in the feeling that he was when she died, which happened 20 years ago. So why should he grieve now about something? And another thing that might happen is that they will not be sad that she died, but they will know that you have a plan. Why did you hide my wife? What did you do with her? Yes, she was here 20 minutes ago. I just talked with her. We just went out to the garden and drink tea together, and she kissed me, or she annoyed me, or whatever wives do to their husband. And so if you're saying she's not here, and I don't really know who you are and why are you in my house, what are you doing here, then probably you did something to my wife. So I need again to shout and fight and hit and be aggressive, okay? So we won't fix the things that they say. We can say, tell me a little bit about your wife. And this way we are letting them away. We are not changing, we are changing, we're changing, but we are not changing. We are relating to the feeling. When a person says, where is my wife? He's really saying, and again, we are connecting to the feeling, not to the word. So he really says to us, I miss my wife. You can relate to this feeling. You miss many people that are not with you right now, right? They are in your home. You miss your parents or your spouse, your husband if you have, or your child if you have, or your brothers or your best friend, or you. So you can relate to the feeling. They miss their husband that they didn't see for 20 years, and you miss your husband or your ima or your abba or your that you didn't see for a year, 3 years, 5 years, I don't know. So that we share the same feeling of missing, and we share the same feeling of wanting to see them. So we can relate to that. And when we're saying, tell me a little bit about Miri, your wife. Tell me a little bit about Moshe, your husband. And in this way, we are honoring the feeling of missing them, and we are talking about the person, but we are diverting it from looking for the person to talking about him. And if it doesn't help, it's a very good idea, and sometimes a very bad idea. It will not work. I don't want to talk about him. I want to see him. What are you? Blah blah blah. Sometimes it will work, but sometimes it will not work. There is not one thing that will always work. So if you try it and it's not working, which probably will happen. This is the most common. The common thing is that it doesn't work, not that it worked. It was a miracle if what I said would work, would always work. Then we can try another thing, like, okay, so usually where she is in the morning, where does she work? And go out, like you said, do a round in the kibbutz, and don't talk about her all the time, because then they will remember there. You go out, and then you say, oh, look how nice the flowers in the garden. And if you meet someone, let them talk with him, and this will fade away this thought, and it will fade it away totally, or it will fade it away for 5 minutes. Both can happen, but it will fade it away for some time. So if they are looking for their house, why they are looking for their house? If this is the same house, they are in this house for 40 years. Why they are looking for their house? Because 40 years ago, it looked different. The picture was different. The light was different. In the memory, it's not the same, which makes it even more weird, because they see it's very the same, but it's not totally the same. Someone is messing with my head. They are changing things in my house, right? So we will not fight with this feeling. We will try to understand. Sometimes if they want to go to the house, we'll go outside. We'll go to the house and we will do a round and we'll come to the house. And when they get in, it will be the house because it's their house. And sometimes we'll say, you know, I used to live in India. And in India, I had a very different, and I also miss my house sometimes. It's very difficult not being in the house that you remember. And we will say something to empathize with their feelings. Sometimes it will be to look for their house, and sometimes it will do to talk about the feeling of missing your own house. Again, a feeling that probably you can relate to. But we will try to be with them in the best way we can. And it will work 20% of the time, and 80% it will not work. But we will try, and we will respect the feelings, and we will talk calmly and respectfully, and not, well, in the house, why do you want? We need to go to sleep now. Because even if we are saying it, and they understand the word, they understand better the tone. Like if I'm saying, yes, but now this is where we are feeling, it's not the same, if I'm saying, yes, but now this is where you are living, it's not the same as saying, this is your house, what do you want? You know, I said the same thing, but I said totally different things, right? So it's easy to say, it's much more difficult to do it all day, every day, with the person that all the time has resistance to what we are doing. So, and I do not think that you can do it all the time. But I'm saying, if you will do it as the best that you can, their life will be better, and your life will be better.
Yes.
And this is the interest.
Quiet.
Okay? Sometimes it's not that they are remembering, like, this is not my house, where is my wife, the things we just, sometimes they really see stuff.
Yeah.
Like, there are people who came here and I talked to them. At night, children came into my house and they took my food from my refrigerator.
Yes.
Like, they're having hallucinations.
And so,
They
this is
see
also
things
the
that are
problem.
not there. And what do we do then? Big question. So, the first thing, as we said before, we need to remember that if they saw a person coming into their house and sitting on their couch and eating, it happened. It didn't happen in the reality, but it happened in their head. So if we are saying shtuyot, why, like, I'm assuming that there are some words in Hebrew that you know because you use it a lot, but if you're saying, did it happen? What are you saying? Stupid stuff. No one is here. The door is locked. Then you are dismissing them and you are not respecting the thing that they know that happened. So again, we will not argue with what they are saying. We will not go along. We will not say, okay, there were people here. We will not say like them, but we also will not fight it. We can try to divert the subject, like saying, going to something else, or we can say, if it's a good feeling, like if they say, my son just came here and I had a good talk with him, but his son is dead for 15 years. He died 15 years ago. There's nothing to fix it. He has a good feeling. He talked with his son. So, okay, so he spoke with his son. It's not important that he died 15 years ago. We will not argue with that. But if he's saying, a person came and he took my stuff and he wanted to kill me, then it's not a good feeling. Then it's a frightening feeling. So we will manage it. We will say, okay, I will remember to lock the door at night and no one will come in. Okay, and I am putting a bell on the door so I can hear it. Now we put a bell on the door, but we put it because we don't want them to go out at night, right? But we will tell him, I put the bell on the door, and if someone came in, I will wake up. I'm hearing that, so we are saying we understand that something bad happened, and we will try to make it not happen again. Okay? We are respecting the thing that they saw. When it's a thing that makes them happy, like the dead son coming to visit, then we don't need to do anything more. But when it's a thing that makes them frightened, anxious, then we need to tell about it to the family, and sometimes we need to tell about it to the doctor, to the physician, because sometimes we will give medication that can help this hallucination be less. What is it in English? Yes, it was not really English, but you understood what I said. We can change it. The medication that we give for hallucinations are awful. they make them weaker, the person.
Yeah,
They
yes,
make them more
exactly.
confused.
More
They make them more stiff, like they cannot walk as easily.
Okay.
And this is the reason we don't like to give this medication. And we will save them only to situation when the hallucination is bad hallucination, like making them, if they feel that someone is coming and wanting to kill them every night, then we need to give medication because a person cannot live with this feeling all the time. But if it's not making them feel bad, it's better without the medication and with the hallucination, because all the medication might help the hallucination but have a lot of side effects. So we need to think very carefully before giving it. It's not give them the medication and everything will be okay. It's not. It's give them the medication. It might help the hallucination, but other stuff will go bad, will go worse.
Yes.
So this is the reason that us, the doctors, doesn't like to give this medication. It's not because we don't want to help them. It's because we know that these medications are they have a lot of side effects. And we need to think very carefully before giving them. And as some of you know, I'm giving this medication. Some of your patients are getting those medications. But what I'm saying is we need to be very careful with them. It's not if things get worse, then let's give them more. No, because if we will give them more, they will be more weak, they will be more confused, they will be more stiff. There are a lot of things that, and also research show that this medication, people who take this medication die more than people who doesn't get the medication, so it kills them also. It's not a common thing that it kills them, but it might kill them. It is a very strong medication. And I am giving them, although I know all this stuff, I know it's a bad medication, I know that it might kill them, and I'm giving it. But I'm giving it when I think that there is no other solution. It's not the first option, it's the last option, okay? So we need to know that, and that's the reason that we are not saying, okay, so give them all, so give them all. It's not the right thing to do. Looking at my watch to see the time. Because maybe one of you, לא הייתי בטוחה אם הוא נכון, אז רציתי רגע לבדוק, אוקיי. Because I don't know if it's one of you or not, but someone is coming to see me at 11, so we need to see the one. Okay, so we talked a little bit about hallucination.
How about the doctor? One of the caregiver here, this kind of situation, they're going to the hotel, and then let her, she feel ashamed, She's thinking about, she's going to eat together with her employer, and then later on her employer try to talk, there's a cash bond. Oh, what you eat is very expensive. How you deal with that?
Yes. So first of all, we need to know if a person, first of all, it's a very bad feeling.
Yes.
If I were
The
you,
caregiver is
and
really
someone,
want to cry.
Exactly.
Yeah.
I would feel very bad if someone would look at my plate and try to say, don't eat that, this, you are eating on my account.
Yes,
You are eating my money.
And
you are living on my account, like accusing you. So I can really relate and understand that this is an awful situation for you.
Yes, can.
But again, we will look at what is the feeling that the person is telling you, okay? So some of them might feel, I'm an old person, okay? I don't have a lot of money. I really don't have a lot of money. I'm a kibbutznik, I don't have my own money.
She don't have dementia, doctor? This kind of woman?
No, it's not for sure that she has dementia, because as we grow older, our character is getting worse. Like if I was a very cheap person, like I always didn't like giving money, and I always gave, if someone would give me a present, I would keep it and I would give it to another person on his birthday. I would not buy him stuff. Like
a lot of stuff I'm doing like that.
Exactly. I always was cheap. This is my character. Most people, as they get older, it will get worse. Like if usually I was a little bit, קמצן זה צ'יפ, זה נכון?
קמצן, כן.
If I was קמצן, a little bit, then I will get קמצן.
Getting worse.
But what
how you deal with that?
I will say, but I want, before answering, I want to explain a little bit more about the feeling. What's the feeling that hides there? The feeling that the person hides is he feels that he is not financially secure. Like if I will not keep my money, one day I might not have food.
Nothing.
Or I might not be able to pay for someone to come and clean the house, or I might not be able to buy clothes. If I will give her, like I'm saying, like her, like
Okay,
using,
yeah.
take
She also
all
is like
mine.
that.
If I will tell her to take all my
Mine.
money, then I will be left with nothing.
Nothing.
Another feeling that a person might hide,
Yeah.
maybe people did exploit them before. Maybe someone took advantage of them. Maybe they were
You heard
married.
that?
Maybe they were married and the person took all their money and ran away. Maybe they had children and their children took stuff from them and now they are not even coming to say hello. Maybe they had a friend that took advantage of their kindness, of their money, and they had awful feeling and they said to themselves, I will not let this happen again. No one will exploit me again. No one will take my stuff again. It happened to me and I will not. So this is the feeling that is standing behind it, and it has no connection to you. So the first thing to know is to understand it. The second thing you should do is to talk about it with the family of the person, so they will know that this is the situation that you are dealing with, because they know their parents. They know that they are kamsan. They don't like to give, they don't like to give to them stuff also probably, and they probably accuse them
The
also.
children knows it.
The children knows it, and then you can. Why they need to know it? Because one way to deal with it is to lie. What's the lie? But you need the back of the family to lie, so it will be acceptable in the family. Like you can say, it's okay. The money will come out from my account. I am paying for my food in the Cheder Ochel. Now it doesn't need to be the real situation, but it needs to be the situation that the family members know. So you're not lying to the family. You never lie. You should probably do, because all of us do that. But you should not lie to the family members. You should have a trust relationship. It's not always easy. Sometimes the family is also complex. Let's say it like that. But lying to the family will make it only worse. But you can tell the family, look, I have this problem. He's all the time accusing me in the Cheder Ochel that that it will cost him a lot. Is it okay from your side? Ask the family that I will say that I am paying for the food, although I'm not. Make sure that they understand that you are not, so you will not take off your money. And although I am not paying, I know that you are paying for it. Tell to the family. But is it okay that in the Cheder Ochel I will tell him it's okay, I am paying for it. And also, you can tell it if it's the same person in the Cheder Ochel that's doing the account, then they should know it also, that it's a lie that the family knows. Because otherwise they will tell the family, you are lying to, they will think that you are stealing from the people you are taking care of. So you don't want to be in that situation that not only your person accuses you, but also the Cheder Ochel manager accuses you. So they need to be in the secret, let's say. But if the family say it is okay, you can reassure them it's not on your account. There is you can say there is an account of the kibbutz that pays for the metaplim. Okay? But you can use this way only if you spoke of it ahead with the family. So this is one way to deal with it. But you should be very creative in dealing with all of these situations. The situation in the Cheder Ochel, and the situation in the shower, and the situation with the kids going. All the time we need to, with the kids going away, we need to be very creative. Because, and I will say something that I'm not sure that everybody agrees on. But I think that it is okay not telling the truth to a person with dementia if the purpose is not the lying, but the purpose is to help them be less anxious, help them be less afraid, help them be less depressed. But it's not okay to lie to the family members. You need to help, and also I'm saying to the family members, and this is something you need to know because it's against you, so I'm telling it to you now. I'm saying to the family member, don't back up the metapelet in front of your patient. Because then the patient thinks you are against them. When you're with your father, if they are saying,
I'm really sorry that maybe there was a misunderstanding about the time.
we are supposed to finish now?
Yes,
Okay, so I will finish the sentence and I will finish. It's okay.
Yes, yes, because it's very, very, very important.
Yeah.
No, okay, I thought I have until my next appointment. It's good for me that I have 15 minutes to.
You will have time to
Yes,
prepare
yes.
for your.
So I will
first
just finish
patient.
the sentence,
Of course,
okay?
and please, I'm sorry for you.
No,
to
no,
have-
it's okay.
So, as I was saying, sometimes I'm telling the family, when you are with the metapelet and with your father, back your father.
Yeah.
Don't
Yes.
back the metapelet, because if you're backing the metapelet, then your father will get more angry.
Yeah, yes.
So if he's saying the metapelet is annoying me, she all the times want to touch my stuff. They should not tell them, no, she doesn't do that. They should say, I understand it's very annoying for you that people touches your stuff. And it doesn't mean they don't back you up. It means that they don't
We
want
know
to
that.
make the situation worse,
Yes,
okay?
yeah.
As I told you, they go along with whatever the parents said. The same for you. If they're saying something bad about their child, you do not need to defend their child. You need to be with them, okay? So we need to finish now because I didn't understand the time frame. So probably there's no time for questions, but we are all meeting in the clinic when you come with your patient.
Doctor. It's really
And
helpful.
in that situation, it is also okay after I speak with the patient and we understand the situation. If you have questions, you can always also ask me, and if I can, I will help. Okay?
Thank you, doctor.
Thank you, Adassa.
And alive.
The best of
Yeah.
Have a good day.
Thank you.
Thank you.